anyone hear me? Can you put your thumbs up, Ali and Tasha, if you can hear me?
We can
hear me. Yep. Okay, good.
Yep. Yep.
Okay, everyone, we're going to kick off tonight. So my name's Kira Rumble. I am going to be your virtual Circle of Support host and MC for this evening. Thank you so much for taking your time out of your night to be here with us. And I just want to say on behalf of everyone, we're really sorry for the loss of your babies. And we're so sorry that you're going through this heartbreak. We see you and we support you on this grieving journey. We want to start with an acknowledgement of country. Acknowledgement is important. To acknowledge someone is to say, I see you, you are significant. Acknowledgement is at the heart of the work of what Pink Elephants are, and where we acknowledge the grief of babies who are lost. To acknowledge the traditional custodians of the land on which we meet today and pay our respects to elders past, present and emerging, and extend that respect to Indigenous Australians present. We all recognise the strength and resilience and the values of the oldest living continuous cultures of the world, their languages, their spiritual relationships and connections with the land and waters. So with that being said, a little bit of housekeeping. We're recording this session, so we've turned off your cameras and microphones. If you have any queries, please message us in the chat box and someone from Pink Elephants will reply. As we go through each panelist, if you have any questions or follow-up questions to ask them, please write them up in the Q&A section at the bottom of your screen and we'll go through them at the end of the session. My name is Kira Rumble. I am going to be your MC. I have studied nutrition and the effect that nutrition can play on mental health. I have two very gorgeous sausage dogs, and I'm the founder and business owner of a brand called Crumbled Foods Beauty Bites, which is available Coles and Priceline. I personally have suffered through the trauma of 5 pregnancy losses and miscarriages. So I feel you on your journey right now, and I know firsthand what you're going through, and I'm so sorry that you're going through it. So please know that I'm here for you if you need. On our panelists, we have Dr. Ali Hodgkinson, who is a GP and has many patients' experiences through heartbreak and miscarriage, as well as having experienced it herself. She has a family planning certificate of sexual reproductive health and has a particular interest in PCOS and loves being able to educate and empower patients to optimize their health in her role as a GP. We have Dr. Bronwyn Lee, who is a clinical psychologist specializing in perinatal and infant mental health. She is a parenting consultant and the director of the Center for Perinatal Psychology and the Center for Mindful and Reflective Parenting. She has had many works published, lectures for universities, presents at conferences, and is interviewed by the media and consults for many healthcare professionals regarding infertility and perinatal loss. We also have Tasha Jennings, who is a fertility naturopath and nutritionist. She helps proactive women and couples improve their fertility well-being to create healthy pregnancies and healthy, happy babies through her personal online consultations, online resources, and premium prenatal supplement. Tasha works closely with leading IVF specialists and fertility clinics and enjoys working collaboratively to get the best outcome for her patients. And then we have Monique Dawson, who is a Pink Elephants Peer Support Program Ambassador, who has experienced miscarriage and now volunteers her time very kindly to support on newly launched live chat on the website about their miscarriages, experiences, their lost babies, and how to take care of themselves through this grieving period. So is everyone good with that big introduction? We're going to get straight in on it with Ali, Dr. Ali Hodgkinson. So Ali, what are the ranges of physical symptoms to expect when you have just miscarried your baby?
Yeah, so the physical process of miscarriage varies a lot between women. So what your friend may have experienced is likely to be very different to your own. And the symptoms can depend on how far along the pregnancy was, and also whether the loss happens naturally or with medical or surgical management. If you miscarry naturally, most women will experience something similar to a heavy period, but with more cramping and bleeding than is normal, than usual. And some women will also have labour-like cramping, and this is basically from the uterus contracting to miscarry the baby naturally. You may also pass clots and sometimes tissue, which is the early formation of your baby. And seeing this can understandably be very distressing. On the other hand, though, if you have experienced what is called a missed or silent miscarriage, where your loss was diagnosed by the absence of a heartbeat on a routine ultrasound, you may not have any physical signs or symptoms at all. And if this is the case for you, and the process of passing the pregnancy hasn't started, you can decide with your GP or gynecologist what the best option for management is for you, from both a physical and a mental perspective. It's a very individual choice. So the options include waiting for the natural process to occur, taking a tablet or a pessary to help things along, or a surgical procedure which may be done under sedation.
And so what are the symptoms that aren't normal, and what are the symptoms that you should present to an emergency department look like?
Yes, so I just want to caveat this by saying that I would really encourage all women going through a miscarriage to see their GP or gynecologist, even if your symptoms are mild and even if it's very early on and you don't want any intervention at all. I think it's still really important to check in with your doctor. And also, if you are unsure if something is normal or not, never hesitate to seek review by a doctor. It can be really hard to know if something's normal, and your doctor's there to support you along the way and to check everything is going okay. But I will just generally mention some things that definitely warrant a trip to your nearest emergency department. So very heavy bleeding, and it's hard to quantify what very heavy bleeding is, but an example would be soaking one pad per hour. So that would be very heavy, and this sounds awful, but passing large clots, so the size of a golf ball, that size clot, it should definitely be going to your emergency department. Also, if your pain is so severe that it's not controlled with pain relief at home, you should also be going to seek medical care. And similarly, dizziness or fainting or feeling faint, this could be related to blood loss or due to the pain. But this is a reason why I really recommend that you have a support person or partner with you at home when you're going through this. And just another thing to mention would also be having fevers or a discharge, an unpleasant discharge, because this could be signs of an infection. And just on that, there are a few things we recommend to minimise the risk of infection. So using pads instead of tampons and avoiding sex until your bleeding stopped. And just one last thing, if the bleeding is going on for a really long time, so if it's not reducing after 2 weeks or if it's getting heavier, then I really think you should be seeing your GP. But as I said before, I think that hopefully you'll be having regular check-ins with your GP, so all these things can be checked on as to whether they're normal or not.
And also looking for shoulder tip pain or anything like that.
Yes, exactly. Yeah, definitely.
So I know from my personal experience, as soon as I had 3 miscarriages, it was sort of straight to getting investigated. But is there a general rule of thumb of how many you can be experiencing for you to then go and warrant escalation to finding out what's causing them, or what do you recommend?
Yes, so I think in the past, investigations were generally done after 3 or more. But now, because of the well-recognised stress caused by miscarriage, investigations are being offered after 2 miscarriages, or sometimes even after 1 if it was a later miscarriage. And it's important to note that an underlying cause may not necessarily be found, but if all investigations come back normal, then people may feel reassured that it's okay and safe to try again. And the majority of cases, the cause is due to the chromosome for the baby not being compatible with life. But I remember after my miscarriage not feeling much comfort from knowing this. But I was reassured to know that, by having had 1, you're not necessarily at increased risk of having another. But I also think it's a good time to remind everyone that it is impossible for you to have done anything at all to have caused your miscarriage, including stress, heavy lifting, exercise. It is absolutely impossible, so you should never have feelings of guilt.
In terms of couples wanting to try medical time frame that they should be avoiding to try and conceive again?
So it's recommended that you wait until you have recovered physically and you're psychologically ready, and obviously that time will be very unique to you. Many couples that are trying to conceive feel that they want to try to fall pregnant again as soon as possible. But medically, it's just recommended that you wait for 1 normal period before you try to conceive. If you do conceive before your next period, it will make it harder to date that pregnancy, which can add to anxiety, may add to anxiety because it's harder to date if you haven't had a period. There was an old recommendation saying to wait 3 months, but studies have since found that there's no need to wait that long, as there's no increased risk of complications in these pregnancies.
Okay, great. Now we'll move on to Bronwyn, but Ali's going to be here to answer any questions later on. So Bronwyn, how can women and men that are on here look after their mental well-being during a miscarriage?
Thanks for the opportunity to be able to participate tonight and contribute to this very important forum and discussion. I do have some things I'd like to suggest, but I would really like to start by saying that there is no one right way to, move yourself within a grief sort of time and a grief experience. And therefore, I can make a few suggestions which may or may not sort of resonate with you personally. But these are some suggestions that I'm happy to make based on what others have found helpful. And the first, so I have 3 suggestions that I'd like to make. The first is really picking up on how you beautifully opened tonight, Kira, talking about acknowledgement and how the importance of acknowledgement. And I think one of the very tricky things about miscarriage is that it's what we call a disenfranchised grief, meaning that it's often unseen and unacknowledged or under-acknowledged. And so it's deeply important, I think, from a psychological point of view, for parents to be able to acknowledge the importance and the meaning of the loss of their baby through miscarriage, that this was a significant loss. This is a meaningful loss. This is a profound loss, and this is a painful loss, and to have some acknowledgement to yourself. If you can get some acknowledgement from others, then that may be helpful, but certainly if you can acknowledge that for yourself. If others are unable to acknowledge the importance or the magnitude of the loss, that's not to say that they are uncaring or unkind. It may indicate that they are unable to see or understand the magnitude of that loss. So that's, I guess, in a way, that's my first point, is to acknowledge the loss and what it means to you and the magnitude of the loss for you. The second is, in a way, to honour your grief, and really what I mean by that is to sit with and proceed with what feels right for you. So in the early days and weeks after losing your baby through miscarriage, do what feels right for you, and that's going to be highly individual. For some, it might look like taking a week or a month off work, hiding under the covers, not leaving the home, whatever, you know, and sort of retreating and withdrawing from the outside world, because that provides comfort. For others, it can look quite different, and honouring your grief might look like keeping things as stable and predictable as possible in all other parts of life, which I think is understandable. One might wish to return to work or see friends or carry on with life in a way to provide some predictability when something very unpredictable has happened. So this is really an encouragement and perhaps permission giving to honour your grief in a way that feels right for you, and do what feels right for you. And the third is to hold a space for some self-compassion. And Ali beautifully said that there is no place for guilt here, and yet we know that guilt can creep in. And if one is able to find an antidote to that through some self-compassion and finding a place of comfort, even moments of comfort, then that's very helpful. And you may need to actively seek out those ways in which you might feel comforted, moments of comfort. And that again will look quite different for different people. It might be that you find a moment of comfort in solitude. It might be in a moment of some connecting with the breath in a grounding sort of way. It may be through being with your partner or a friend or a parent. It might be in an embrace, a hug, that there is a moment of soothing comfort. And so really finding what your points of soothing comfort are and leaning into that as much as possible.
Thank you. And in terms of couples, what do you recommend for couples to navigate during this difficult time together?
Yeah, I think it's really tough for couples often. I mean, you know, some couples will find their way to each other in a with renewed kind of, you know, comfort and perspective and strength. And if that is the case, then that's excellent. For some couples, this can feel a little more, you know, divisive. And so it's important to note that even the most stable, loving, wise couples can, you know, feel the strain of a loss of a baby through miscarriage. And really, I guess the point here is, well, a couple of points. One is that this is really a time to be kind to oneself, but also to one's partner. And I guess to honour that while you may have your own grief journey and what feels right for you, that may or may not be similar to your partner, and to have some respect for how your partner is going. If it's possible to check in with each other, then that's really good without too much hurt. If it's possible to check in with each other, then that is ideal. If you are able to turn to each other for some soothing comfort, then that's very helpful. But of course, that's not always possible. But if you can check in with each other and language, this is where I'm at, or this is what feels right for me. And to honour and respect that where possible, that can be quite helpful. And while we're talking about partners, I would like to say that while of course we are concerned with the mental health, the emotional well-being of women who are carrying the baby and lose the baby physically. If there is a partner involved, then someone else has also lost that baby. And I think that can be forgotten. And I think it's deeply important to remember that, for all of us to remember that there are usually two people who lose this baby. And so to hold that in mind as well.
Thank you. Okay, so Bronwyn's also going to be staying around. So if you have any questions for her after the panel, we will get into them. So next up, we've got Tasha. Tasha?
Yep.
Tasha?
Tasha, yep,
Tasha. So you love the holistic approach. So how should women be thinking holistically in regard to their body once they've gone through a miscarriage?
I think, look, I love what you've already spoken about so far. It's that acknowledgement, and really an acknowledgement of your body. You have carried a pregnancy. I think, as Ellie said, there is a tendency to jump forward and go, okay, I want to get pregnant again. I want to get pregnant. Just pause. Acknowledge your body for what it has done. No matter how short or long that time was, your body has actually carried that pregnancy. There's so much development and growth that your body has fueled. So really understanding that and just pausing and acknowledging your body for that. I see a lot of my patients feel quite negative towards themselves. There's frustration. There's, you know, why did it happen to me? A real negative approach. You want to just get that whip out and crack it and get my body working again and move forward. But acknowledge your body for the work it's done. It's done a lot of work. It wasn't the outcome you wanted, but your body has really gone through a lot. So, and it's not just your uterus that's gone through the work. It's your whole body. We are not just, you know, systems. So, you know, look at your hormones. They may take a while to get rebalanced. Stress, emotional and physical, nutrient depletion, adrenals, thyroid, a lot of things can be affected by the miscarriage. And as Ali said, they're all different. So like, you know, Bronwyn was saying, check in with your partner, check in with your body as well, you know, and see what is feeling right for you. And it is a holistic approach. Your whole body has been in this pregnancy and you have carried and developed that baby. So real acknowledgement of that.
So considering stress and anxiety and grief that you and everyone would be dealing with when we have a miscarriage, are there any other additional changes that people should be trying to make in their diet to help improve recovery? Or if they're trying to conceive again, are there any other nutritional benefits that we should be adding in to focus on conceiving that happy baby again?
Again, like we're talking about that self-care, like Bronwyn was saying, it's so important, that self-care, and that comes to food as well. So when I'm talking about food post-miscarriage, it's all about, think your Nana's chicken soup is kind of sums up the sort of food that I want you to be having. Really warming, really nutritious. Something's going to provide lots of nutrients and minerals and healing properties as well, because there's a lot of healing physically and emotionally. So warming foods, soups and stews, really nurturing your body, nutrient dense food. And there might be, you know, a tendency to gravitate to the chocolate and things like that. And I allow my patients to feel that as well. So I do acknowledge that that is a part of it, and you may want to grab those foods. But looking at particularly your minerals, things like magnesium is super important because it's depleted by stress, physical and emotional. It's really involved in muscle and cramps. So magnesium is really important. It is in dark chocolate. So that's one thing you can kind of cross as the good bad line. So some dark chocolate and things like that can be beneficial. Nutrients like zinc, which is in your, you know, your lovely bone broths or chicken soups and things like that, in meats, is very important for the healing process of your body. So really getting nice nutritious food, some TLC. Ideally, I had one of my patients, her partner made up the lovely soup for her. I think that's awesome. You don't ever have to do it, or get your mother involved. We tend to do this for women who've had babies, but you've carried a pregnancy. You really need the same nurturing, that food, that comfort food. Look after yourself.
And we are living in uncertain times with COVID, so we've got a few people that are in lockdown at the moment. Is there anything else that people should be aware of? So exercise, is that encouraged? We've got limitations around. What do you recommend?
I've been talking through isolation, I guess, techniques and strategies. I feel like the past few weeks and even before that. The one thing I'm noticing, probably number one, is certainly lack of exercise. But I think for me, it's the processed food that people are grabbing. I spoke to a couple just yesterday who were so good when they were at work. They had their salads organised the night before. They had all their meals organised for the evening. And since isolation, they're both working from home and having cheese toasties all the time. So it's creating the new normal for you, and what's going to be creating a new routine. And I'm talking to a lot of my patients about creating that new normal routine for yourself and establish a bit of a pattern that you can do, because people are sleeping in, we're getting later. So getting some wholesome food into your diet instead of just the processed food. So good ways to do that if you don't want all the trips to the supermarket, which we're all trying to avoid. But remember, things like a whole pumpkin. I always have one of those sitting on my bench. They can last up to 6 months. So having some sort of fresh food that is going to last, freezing and batch cooking is your friend. So go to the market. One of my patients grabbed a whole lot of salmon and cooked up soups. So cook up some beautiful soups and stews. I've got a lovely recipe book that I send to my patients and encourage them to batch up and freeze them. When you are freezing, do note, I recommend glass. Ideally, don't put it in plastic containers. Freezing has a similar impact as heating on the BPA leaching into the food. So glass containers, but batch cooking and looking at foods that are going to last and sustain you, that are still fresh and nutritious. So, and even services, I know I'm using Your Grocer at the moment. I'm sure there's a few others out there, but I still get all my veggies from the market. So I put in my weekly order and they get delivered in a lovely box. There's some organic places that are doing deliveries as well. Because I had one patient who was so concerned about eating organic that she pretty much stopped eating fruit and veg because she couldn't get organic. So just won't eat any fruit and vegetables. That's not the answer. Ideally, get the best source that you can and batch cook it, and some improvisations for isolation.
And if someone has been trying to get pregnant for some time without success after a miscarriage or even before a miscarriage, should they be considering taking supplements? And if so, what ones do you recommend?
I think that is such an individual thing. And I think, as you know, Ali was saying, every miscarriage is different. So it's always healing from the miscarriage is your number one, and then looking towards the pregnancy. I always like to get the fundamentals right. And a lot of my patients come to me taking what I call the sexy supplements. So we've got coenzyme Q10, your expensive antioxidants, carnitines. They're the ones all you see in all the headlines. They're going to create good egg quality. And yes, they are very beneficial, but they're the icing on the cake. And icing's no good without the cake. What is going on with the cake? We really need to get, first of all, your basic nutrients right. So folate is critical to a healthy pregnancy, and we want to be getting it into the bloodstream and into your cells, not just in a tablet. So I'm all about creating nutrients that are absorbed properly. So check on your supplement. I'm quite passionate about that. I created my supplement, Zycia Natal Nutrients, when I was struggling to conceive, because I'm really passionate about not the nutrient just being into the tablet, but actually reaching your bloodstream. So folate particularly, a lot of people have difficulty metabolizing folate. A blood test is not really helpful. It actually just shows that you've got folic acid in your bloodstream. So if you're taking your folic acid supplement, it'll be high. It's not showing that you're metabolizing it and absorbing it and using it. I like to look at homocysteine levels as well, just to see how that folate's being metabolized, perhaps MTHFR if the homocysteine's raised and there's issues there. But looking at a supplement with folinic acid and folic acid. So 2 forms of folate plus dietary sources. A supplement should never replace dietary sources. So get adequate folate. Look at choline. Is really important alongside folate for the development of the neural tube. So this is basic things we can get in our food. So I send my patients a list of folate-rich foods, of choline-rich foods, which is really important for neural tube development. So look for a prenatal that's got some choline in there. Zinc is really important for egg maturation. So if we're getting immature eggs, it's important for ovulation. So if you're not getting regular ovulation, also, as I said, important for any sort of healing. So post miscarriage, zinc becomes really important. It's actually important for men as well, across both parties, for reproductive function. So really getting your basic nutrients right. So B12 as well is another one that I like to check. And then thyroid issues or bowel, IBS. I see a lot of people with bloating, constipation, diarrhea. That's going to affect nutrient absorption. It's going to affect inflammation. So a lot of my specialists we work with look at inflammatory markers. I'll look at thyroid, look at antibodies. Is there anything going on? The main thing I want to do with my patients is optimize the environment that the eggs are developing in. And the eggs take a 90-day process to develop. So if we can optimize the environment, the internal environment in which those eggs are developing, then we can have a better chance of creating a healthy, viable egg that will go on to create a healthy pregnancy. Because a lot of things are out of our control when it comes to biology and reproduction. And as human beings, we naturally do produce a number of eggs. I think a quarter of the eggs we release at ovulation are not viable. They're not capable of creating a pregnancy. That's just how we were built. So I think having control over what you can control, I think, as Bronwyn was saying, is really helpful for people, to give them something that they can do and feel like they're working towards creating that healthy pregnancy by just optimizing the environment in the body. So looking at digestion, looking at thyroid, I look at, ANA, ENA, some of the inflammatory markers, see what's going on in the body, sometimes liver function, really do a deep dive into the person's general health. And then all the sexy supplements and the cream on the top. So they're going to be helpful if we can get your basic general health right, and men as well. A lot of women come to me with recurrent miscarriage saying, he's okay, he's fine, his sperm results are pretty good, and he gets me pregnant, it's my fault, I can't stay pregnant. Number one, as Ali was saying, number one reason for miscarriage is that the embryo that wasn't compatible with life. There's chromosomal issues. That takes two. So sperm is involved in miscarriage, same as the woman. So I like to look at sperm health as well. And even if it is normal and within range, I know a specialist I deal with, she was saying, 20 years ago when she did her training, sperm results were a lot better than they are now. We've actually lowered the parameters. Doesn't mean we can get pregnant easier. It's just that sperm is reducing in quality. So if I see someone on such a lower end of normal, I want Olympic athletes, I call them, when I'm talking about sperm, because you've got a better chance of creating that healthy embryo if you've got as good quality as you can get on both sides. So yeah, sorry I couldn't say one single supplement bits and well.
No,
I don't like to tell everyone one, because there is no bulletproof answer. It's about creating a healthy environment for you.
And this isn't part of my question list, but more of a curious question. What are some of the foods that we should be looking to introduce if we're not already eating them that are high in folate and zinc and things like that?
Yeah, nutrient dense foods as much as possible. So folate is in your greens largely. So if you cook them like my nan used to, you pretty much lose your folate. The difficult thing with folate, it's quite unstable. And that's why I recommend a supplement, just to make sure you're getting sufficient levels. But always have your greens, have them blanched or lightly cooked is a really great source. All of your, superfoods, your blueberries, and I'm big on colour. I actually give some of my patients, it's a kid's chart to be honest, but it's got green foods. How much did you have today? Red foods, yellow foods, because we can get stuck in a rut. And I know I love pumpkin. I know I have all that. I'm often eating yellow food and I have to go, okay, have I had some red? Have I had some blue? Because the color component provides phytonutrients, which have healing and medicinal properties beyond their, vitamin and mineral content, and they have antioxidants. So yellow is really important for uterine tonic. You can get your blue purple is probably the one that 90% of people don't get enough of. So I think blueberries, eggplants, all your blues. So the biggest thing you can do is eat a variety of quality vegetables from the best source you can. And again, I had that patient who's obsessed with organic, and I do love organic. Organic's the way we were meant to be eating. It just means it doesn't have pesticides in it. I do have a list of the clean 15 and dirty dozen, which I give out to patients, which is basically a list of the highest pesticide load foods versus the lowest pesticide load foods. So it's a good guide, but in general, I guess foods like celery, really porous. And I saw a skit on Play School, not relevant to fertility, obviously, but they put the celery in the food diet and stick turns blue. That's what's happened to pesticides when you, I guess, have the celery and it absorbs it. Whereas foods like eggplant, banana with that skin, not so bad. But if you can't get organic, doesn't mean you don't eat it. Get the best source you can. So if you can find a small grocer, a farmer's market, or I'm using your grocer to get it from local markets. So get there from a good supplier, get good quality food, buy it in season. I got asparagus the other day and it came from Mexico. I was horrified. So get it as local, as seasonal as possible. The closer to the ground or the tree you can get your food, the more nutrient dense it's going to be. So yeah, a good supplier, a good variety of colour.
And do you wash your veggies?
I do wash my veggies. Yeah. So
in just plain water, or do you put apple cider?
Yeah, you can use apple cider. There's a colleague of mine who is huge in environmental medicine. She runs the College of Environmental Medicine, and she has some, things you can use to soak your foods and things like that. I personally, I've got a little hand scrubber, scrubbing in some water, that does the trick.
Yeah, great. Thank you. Thank you so much. I'm sure everyone's loving all of this juicy information. Okay, so we've got Monique, and Monique is a wonderful Pink Elephant support person. So I've got a few questions for you. First off, we've got, how does Pink Elephant support those people going through pregnancy loss? Can anyone hear that or not?
No.
No, we can't hear you, Monique. No. We heard you before.
Is that better?
There we go. We can see the green light now.
Yeah, okay. I must have moved it when I had a drink of water.
Okay, so I'll ask a question again. So how does Pink Elephant support those that are going through pregnancy loss? I can't hear her again. Can you guys? Can you try talking again, Monique?
I'll hold this down.
I can hear you now.
Can you hear me now? Yeah, sorry. Okay, so I come from a place where I have experienced marriage miscarriage some years ago. And I wanted to get back when I came in contact with Pink Elephants.
I'm sorry, Monique, you're just gone a double echo, so you're going to have to mute one of your screens. Sorry to interrupt.
That's all right.
That might be a bit better.
Is that better?
That's perfect. Thank you. Start again. Start again.
We'll take 4. As this is a great example that life doesn't always go according to plan. Okay, so I came in contact with Pink Elephants about 12 months ago, and years ago I had a miscarriage, and I found the Pink Elephants a great opportunity to give back to women who are experiencing loss. So Pink Elephants Circle of Support offers women a unique opportunity to speak to women who have experienced loss, miscarriage, and provide them unique opportunity to speak with them about it. The recording is actually doubling my end. Is it doubling yours?
A what?
Are you hearing what I'm saying twice?
No.
Okay.
Just you.
Okay. So women experiencing loss can book a 15-minute support telephone call online. It's not counselling, it's purely a support exercise where the Pearson Board ambassador can validate the feelings, which can be quite overwhelming, as you all know. So it is very unique in the fact that you're speaking to someone who's experienced a loss rather than perhaps a doctor or family who do their best to understand but don't know it from your perspective.
And I think that that's so important going through the experience. Is sometimes people try to be there for you, but they just don't understand, and it really helps to have that barrier opened up when you have someone that understands what you're going through.
That's right.
So emotions, what emotions are considered normal and part of grieving?
I think it's very normal to feel shock. You think that you're going on this journey one way and suddenly it is abruptly interrupted. So many women feel sadness, hopelessness, loneliness, guilt. And it's important to recognise that nothing you have done has contributed to this loss. And I think Tasha mentioned before about the combination of the egg and the sperm coming together, which is obviously both parties are involved. So I think women are very quick to take ownership of the loss and say it's all my fault. But of course it's not. There's nothing she could have done to have changed the situation. So it's really important to not take ownership of that and look at it as objectively as possible.
So what are some ways that you recommend women who are experiencing a miscarriage to look after emotional well-being?
I think it's important to just really listen to yourself, and if you feel like staying in bed all day, one day or a couple of days, that's absolutely fine if that's going to help you. Just process the loss. Also, personally, I find with any type of grieving or searching, often women find that the relationship between themselves and nature is very healing. So whether it's a walk on the beach or a walk in the bush, or just around the block, simply just fresh air and space just to process everything that's going on in the head, which is usually a lot.
Yeah.
A lot of conflicting thoughts that, you know, I'm to blame, I've done this, what have I done wrong? Why can't I have a baby? Why does everything go wrong for me? All those sorts of destructive thought patterns. So that I also think the importance of seeking out friends who will support you. And some people surprise you with their reactions, but generally you have a good idea of people who are normally supportive with you. And if you test the water and you get negative vibes, or someone says, oh, well, you know, I've had 4 miscarriages and, you know, I just got on with it, particularly the older generations, I think it's really important to protect yourself from those people and not invite comment if you think that that's going to be an issue.
And what are some of the things to remember to get through the heartbreak that you're going through?
I think it's really important to know that you have every right to feel the way you feel, not to apologise for it. So many people that I speak to apologise for getting upset or not being able to accept the news that the pregnancy is not progressing. So it's important to really understand that this will pass. It will be hard for quite a while, and there will be certain things that will trigger from time to time, but you will get through, and you haven't contributed in any way.
Wonderful. Thank you. Thank you everyone for your time, and I'm sure we've got a lot of questions for the panelists. So if you want to just send me a message personally, if you don't want your name to pop up, which a few people have done, or if you just want to pop them into the little Q&A box, we can get going and answering some questions. Did any of you want to say anything before we get into the Q&A from the panel? No? Okay.
Can I just add one thing?
Yeah.
I didn't mention about the chat sessions on Tuesday and Thursday. We have the chat sessions online where you can speak if you feel more comfortable texting. You can have an open conversation with one of the peer supported ambassadors, and just a nice, easy chat about how you're feeling, and you can download.
Amazing, thank you.
And can I just say one thing as well?
Yeah.
So I only experienced one miscarriage, but I really felt that the only sort of comfort I got was from, well, one friend who I knew happened to know had experienced it, and speaking to her about it, similarly to what Monique said, you know, you have friends that really want to help and be there for you, but because they haven't been through it, it's really hard for them to offer you much comfort. And I really did find that the Pink Elephant support network, of the Facebook groups and everything, just really validated the way I was feeling and really helped me sort of feel safe and normal in the grief that I was feeling. So I think that's really important.
Amazing. Yep. So I'm really thankful to be able to have this opportunity to connect with everyone. So we'll get into the questions. This one's quite a specific one, but I think that you might be able to give some guidance. So after 2 D&Cs to resolve my last miscarriage, what effect might 2 general anaesthetics have on my egg quality for the next few months? So I would say a doctor. Yeah, maybe Ali, do you want to answer that?
Yes, I'm so sorry that you've had to have 2 D&Cs to sort of go through this for your miscarriage. It must have really dragged it out and just made it that much more difficult. In terms of the effect that it's likely to have on your egg quality, the general anaesthetic, I'm not an anaesthetist, so I'm not, you know, too sure about the specific. I think maybe Tasha might know more about egg quality than me, but I think as a general rule, I think if you're eating healthily and not smoking, and, you know, medicines do tend to detox through the body. And because it's not likely to be a long procedure as well, I highly, highly doubt that there would be long-term risks or effects on your eggs, but Tasha might be able to help with that.
Just to reiterate pretty much what you said as well, Ali, it's going to have a massive impact on your egg quality. I have 2 anaesthetists in our family. You know, as long as everyone's individual. So yes, if there is some liver issues and some other issues that may contribute to that, but in general, eat healthy, look at all your other factors, get your bloods done, make sure you're feeling well, you're in a well position. But I don't think the anesthetics themselves, obviously it's a big ordeal that you've been through. And again, I reiterate, I'm really sorry that you've had to go through that. But the anesthetics themselves, I wouldn't be too concerned that you've caused any damage. I think, yeah, get yourself healthy and you'll be fine.
I actually had the same thing with my miscarriage. I had the D&C and then I had retained products. They call it retained products, but basically it didn't. And that's a common thing that can happen, unfortunately. It just really drags it on. So, yeah, I just feel for you. That's really just a way to really make it even worse than what it is. So I'm so sorry.
What are some of words that you can sort of put in place to help protect yourself against unhelpful comments? I'd say that would be a Bronwyn or anyone.
Can you repeat the question, Kira?
What are some words for protecting yourself against unhelpful comments?
So if you reveal that you've had a miscarriage and you get an unhelpful comment from someone, well, I guess you want to just simply put it to rest and not try and keep the conversation going. It might be as simple as saying, I appreciate your thoughts. And just leave it at that. I would tend to try and contain rather than sort of try and have a discussion about it. I guess it depends who you're talking about. If it's a stranger or a work colleague, or if it's your partner. If it's your partner, then you might take a breath, take a day, have a think about it, and come back and have a conversation about it to say, when you said that, this is how I understood it, and it hurt me because this is what I thought you were saying, and is that true? So you might try to sort of clarify. But if you're talking about someone saying something hurtful, or don't worry about it, just move on, or something dismissive, which often starts with at least you know you can get pregnant, at least you know you're young, you can have another one, you've got time, at least you have a husband, partner, whatever. These sorts of highly dismissive comments that start with at least, which is really to say it actually doesn't matter so much what happened because you have this. It might just be a matter of saying, appreciate your thoughts, or look, I don't see it that way, or something like that, just to leave it at that. That's one option. Perhaps others have some ideas, and Monique, you would hear this too. You would get these sorts of conversations too. What do you?
That's right. It's a good opportunity actually to mention that on the Pink Elephant website, we have some wonderful resources for letting other people know what is helpful and unhelpful to say. So perhaps some people on this webinar may be a small person, and the website may provide you with some suggestions of what to say and what not to steer away from.
Yeah, I think a lot of people have had that at least comment once in their lifetime, which is really unfortunate. Someone has asked, is journaling a good way to deal and miscarriage?
Kira, you were breaking up a little bit when you asked that. I'm
sorry, can you guys hear me properly, everyone else? Or is it just...
And now.
Sorry. So someone's asked about journaling, and is it a good way to deal with grief and coping?
May I say something to that? Because I work with a lot of women and men who journal, and I think it's a beautiful way of languaging your experience in a way that is non-judgmental, where you get to decide who sees that, if anyone. And if you're someone who gravitates to words and gravitates to writing, then I think it's an excellent way of yes, languaging your experience. So if it works for you, yes, of course, I'd encourage you to do so. Yeah.
I also think that some people find it much more comfortable to use the chat facility for that reason. It's almost like journaling in a way, with some prompting, of course. But it is a very popular way of people sharing their pain if they can't find the words physically.
Thank you. Okay, so does IVF give you a better chance of not having another miscarriage?
I can help answer that one. So, because we've already discussed that the most common cause of miscarriage is chromosomal abnormalities, IVF doesn't necessarily can't pick and choose which embryos have a chromosomal abnormality unless you did something which you can do in IVF called genetic screening. But I think generally speaking, that's a quite invasive and obviously it would be a path that is an option. But I think if you've had maybe a few miscarriages, I think the first step would be to go to a fertility specialist and talk to them about your specific situation and then have the investigations done, because it could be something as simple as your uterus may have a little septum which can be fixed, and that might be what's causing it if it's not the chromosomal issue. So I think the more important thing there is to say that seeing a fertility specialist or talking to your doctor is likely to help, but it may not necessarily mean that you should go down the route of IVF straight away. There's a lot of steps before that. Yeah.
I'll speak to that as well. I agree with you, Ali. And IVF is amazing technology, and I work with a lot of specialists, but I also get referrals from a lot of specialists who they can do a great job of getting the egg and sperm together. And if there's functional issues and blockages, they can do a great job of overcoming that and creating a pregnancy, which otherwise wouldn't have happened. However, they can't improve the quality of the egg and the sperm. And yes, you can get PGS testing, and a lot of the specialists I work with do that quite routinely these days. However, the body is very smart. The body will release the best egg you have at ovulation. The best sperm will get to that egg because it is going to be the one your egg actually chooses the sperm. So the body is pretty good at getting the best quality you have available there. And I think people think, okay, if I get 15 eggs, that's got to give me a better chance than me just producing one. The thing is, we always have a dominant follicle, and that dominant follicle is always the healthiest egg. So if you get 15, if that dominant follicle wasn't going to be healthy that month, then those 15 aren't going to be viable either. So the body's pretty smart. IVF is amazing technology. You know, I do love that we live in an environment that we have that available to us, but it doesn't necessarily get all the testing done. You said, go see a fertility specialist, go see a GP, get all the other testing done, find out what the issue is for you, and then we'll know the best way forward.
So I think that's a really good answer. Thank you, both of you. Thank you. I've had 4 miscarriages, and it's really hard to talk about it with my work, as I know I need to take more time off work. But sometimes they don't understand and will put me even more pressure. So some great tools that we can use when dealing with employment that we can really put in place to sort of get that understanding that we deserve. Because sometimes a 2-week medical certificate does not cut it.
Sorry, Kira, I just missed, you broke up a little bit.
Sorry, let me change my other AirPod. What did you hear and what didn't you hear?
It broke up sort of in the middle, so I missed most of it.
Sorry, I've got dodgy AirPod in. Okay, is that better? Can you hear me better now?
Yes.
Okay, let's start again. So what are some really good tools and tips and tricks that we can implement when we've got that if we're having recurring miscarriages, how do we set up this sort of understanding and acknowledgement that when we're not dealing at work and we need to take more time off, because sometimes that 2-week medical certificate's not going to cut it. Maybe Bronwyn or Monique.
I think it's important to choose wisely. If I've had a lot of people that say that they just understand that their manager wouldn't, their direct manager wouldn't understand, so they haven't shared the situation with them, which is wise, and it gets back to protecting yourself from comments. But of course, if you do have a supportive work environment and you feel comfortable, it is always good to lighten the load if you can. But it's really something you can only judge.
Yeah.
I find this a tricky question to answer.
It is.
And maybe I'm not fully understanding, but I find it tricky because it depends a little bit what the purpose of speaking to work is about. Is the purpose to speak with your manager in hopes that there is some understanding and your workload can be lightened, or you can take time off? I mean, if that's the case, I guess, and it depends where you work and what the structure of the organization is. Sometimes HR in the middle might be able to help or not. And I guess it's thinking somewhat strategically yourself about where are the areas within your own workload where you can lighten or pass things on or work from home a little bit or whatever it might be, and perhaps to go into a discussion with your manager, and rather than speaking only from the heart, if I can say it like that, only speaking from the heart and saying, look, I'm really hurting here and I'm really struggling, what can be done? But to also go in with perhaps some of your own ideas to say, listen, this isn't quite working for me at the moment. I really feel that I want to give my best to this job or to my role, and I wonder if there's capacity to take myself off this project or focus only on this project or work a little bit from home or whatever, and I guess to come up with some ways to work collaboratively. And if you lead with sort of a collaborative effort about how can we make this work, so that I can give my best to the job, perhaps a manager who might otherwise be, less compassionate, might be able to kind of work a little more strategically that way. That's one idea that comes to mind for me.
Great. So Ali, this is for you. Ali mentioned after one miscarriage, there is no increased risk of another. I'm currently going through my second and I wonder if my odds are different now.
Yes, so I just sent a message to this person, but what I was saying is, but I can answer it in case anyone else is in the same situation. So of course, I'm really, really sorry that you've had 2 losses, and as we keep on sort of discussing, like encouragingly, it is more than likely that you won't experience another miscarriage, because it can just be you've been unlucky and you've had 2 chromosomally abnormal embryos. However, I would say that, it's probably a good idea, because you would be worried about a future pregnancy, whether or not you will have an increased risk. And I think it would be an idea to speak to your doctor and get some testing done, so that you can be reassured going forward. And even people who have had sort of 3 pregnancy losses and they go on to have investigations done, and these investigations come back all normal, they're 80% chance of having a normal pregnancy in the following pregnancy. So even though it can be so difficult, I can only imagine, because I've experienced one myself, and I can imagine the the fear and uncertainty and worry that would come with having recurrent miscarriages. So I think it is important to really try and seek the answers, and there may be treatments that can assist you. And similarly, if there are no answers, that's also can be reassuring to know that unfortunately it's just been really bad luck, and it's we can be hopeful for future pregnancies.
This is sort of carrying on from this question from another couple. I'm 35 and my male partner is 41. We have experienced 2 miscarriages now, both due to blightum ovum. Are we more likely to experience another miscarriage now that we've had 2?
Similar answer. I think we do know that with age, egg quality does reduce. So the chance is, as you get older, so in your 20s and early 30s, your chance is about 15%. And going up into your mid 40s, it gets up to sort of 90% because the egg quality decreases. So 35 is still, it's a slightly increased risk than in your 20s. It is an increased risk. So I think that the factor would more be related to, you know, if you're in your mid 30s, you may have more miscarriages. You may be someone that will have more miscarriages than someone in their 20s, but that doesn't mean that your next pregnancy won't continue on, if that makes sense. So the short answer is I think it's more about the age that would affect the egg quality than having had 2 previous miscarriages, but I would definitely encourage you to seek a specialist opinion and have some investigations and get their advice on what you can do to try and reduce your risk for next time.
And definitely get the partner as well, the sperm quality. I can always come back to that, especially with older eggs. As women, I like to say we are biologically programmed to fix our men, to, you know, get them and make them a little bit better. And we do that at a biological level. And our egg has the ability to actually get an okay swimmer, and we can, I guess, make changes and actually create a pregnancy by, I guess, fixing any issues in the sperm and go on to create a pregnancy. As our eggs get older, as Ali was saying, they have less energy available. They're not as energetic as probably we are as we get older, and they want a perfect sperm. And so the better we can get, the better quality sperm we can get, as I said, even if it's within normal range, got more of a chance of achieving a successful pregnancy with a super swimmer and an okay egg than an okay egg and an okay sperm. So look at yourself, obviously, which most women are generally doing, I find, is making all the changes, but get your partner involved too.
Yes, and I'll just add to that, with sperm tests, the most common one that we get that men can have done is to check the quantity of the sperm and sort of how fast they swim. But there's another test which a lot of the fertility specialists do that actually look at DNA fragmentation and that's again to do with the chromosomes and genetics. And that's a really important test to get done, and it's not always done in the first line investigations in men. So that's important. And things like smoking, being, you know, overweight, having an unhealthy diet, those sorts of things can affect the sperm quality. So just agreeing with Tasha that it is really a teamwork, and trying just to address all those factors is really good.
And I've got a great chart that I show my men because I find they don't want to hear about it. And if their sperm is considered normal, if they've been told it's normal, they don't want to hear about getting it better. It's fine, I'm all good. But I have a chart that I usually show them and go, here's where you are and here's where optimal is. And it's by the World Health Organization. So it's and I don't even need to say anything, just here's your results, compare them to this. This is optimal outcomes, this is your outcomes. So even within range of the big scope. So yeah, if you need a copy of that, send me an email, I can send it over to you.
DNA fragmentation was something we found in our investigation, which we, through right supplementation and right diet and less drinking, was fixed, which is very lucky for us.
Mm.
So yes, very much an advocate for what you are both saying about the sperm. Okay, we've got a lot more to get through. So we have, does having PCOS increase your risk of miscarriages?
There is some data to say yes. There is, because there is an increase in the male type hormone. So a lot of fertility specialists may prescribe metformin as an option, and I'm sure Tasha will advise lots of other, I mean, obviously trying to reduce your male hormones naturally as well, and reduce insulin resistance. So a lot of that, again, is done holistically with diet and exercise. But I would definitely encourage you, if you have PCOS and you've been experiencing miscarriages, to see your GP, naturopath and or fertility specialist to look at all your blood tests, you know, examine you and find out exactly what's going on, and then they can offer you tailored advice as to how to best manage it.
Yeah, I would agree with that. As PCOS, you're generally producing a lot of eggs, and often they get a good collection. It looks good if you do IVF, but they're often not great quality, and it's always quality over quantity. Just had a patient recently who was 42, and we worked together for 6 months to improve her egg quality, and she got 2, and then like a cancel cycle, there's only 2 follicles. And we've worked so hard on the quality. I'm seeing her through, last trimester care and working towards birth now. So it's really about the quality. So looking at PCOS, as Ali said, there's lots we can do. Insulin resistance is big, but weight loss, obviously, but that's really difficult when your body's working against you. So get the support you need to get those hormones under control, get that insulin under control. Herbs, nutrients, working with a specialist, a GP and a naturopath is such a great team. And I work with a lot of combinations like that. So get your support group, get the help you need, and yeah, there's lots you can do.
So this one is for me. Do you have any tips on how to pull through miscarriage one after another? I find it very hard going through a stillbirth after a miscarriage. So for me, anyone, please feel free to DM me or email me or send me anything. I'm more than happy to respond, but just really quickly, speaking about it was probably the number one thing that has helped me get through everything. The first 2 that I had, I kept it very much a secret. I was very so much shame was going through what I was going through. And it wasn't until last year that I started speaking about my miscarriage that I was going through, an ectopic pregnancy. And just speaking about it has just helped me so much. And I think journaling, meditating, acupuncture, and getting the right medical support team around you is just the number one thing. So for me, I went to a fertility specialist, a GP, an obstetrician, gynecologist, and a sort of an integrative, holistic sort of medical team. And I found that right support network has really helped me get through it. But time also, I could go on for ages. So we've got some other medical ones, so we can get through those first. Would getting genetic chromosome testing done prior to falling pregnant again help the outcome?
It is in one of the workup tests. So it depends how many miscarriages you've had, but at the same time, you're allowed to go and request investigations, even if it's been 1 miscarriage. Just go and talk to your doctor and say, I would like to get investigations done. And yes, we do usually do what's called a karyotype of, which is checking your chromosomes, and that can be done obviously both mum and dad. And yeah, so that's definitely something that can be done. And obviously if it shows anything, then that can be addressed. And if it doesn't show anything, then that's reassuring.
So, oh, that echoed. Can everyone still hear me properly? I'm now cautious that it's not working. This is sort of tapping onto what we were talking about before. So how to deal with reoccurring miscarriages with all of the tests and just waiting. So maybe Bronwyn and Monique.
Can you just repeat that? Do you mind that?
How to deal with reoccurring miscarriages with all of the tests and just waiting.
Yeah, the real theme there is the waiting and the uncertainty that comes with the waiting. And uncertainty we don't really like as humans. We like certainty, we like to know things. And so uncertainty brings with it anxiety. And so it's really kind of tolerating some of that and finding ways to tolerate the discomfort of the anxiety and the uncertainty that sits underneath it. I don't think there's an easy way to do it, but coming to tolerate it, we can sort of get some stamina around that if we practice. You mentioned meditation before, Kira. I mean, one doesn't have to meditate, but if you can sit with the discomfort and label it, name it, I feel uncomfortable, whatever words are in your mind about that. If you can label how you're feeling a little bit and sit with that, knowing that it's not forever and it will pass. And to acknowledge, I don't like this uncertainty. I want to know. This is very difficult. Having some self-compassion around that can be helpful. Takes a bit of practice, though, if that's not a fairly natural state for you. I feel you.
Yeah, I'm the most impatient person.
I also think it's really important to expect a positive result, which I know is very hard when you've had lots of negative experiences or even just one. But, you know, really try to be consistent in expecting the positive outcome you deserve.
Yeah, I love the quote that I thought, when you're having negative thoughts about how all this is going to turn out, remind yourself that you're a terrible fortune teller. So basically, we don't know. And as Monique said, hope, look at the best, look at the positive outcomes. No reason to believe otherwise. You are a terrible fortune teller. You don't know what's going to happen, and worrying now and then worrying then. And also, I find my patients, obviously some have been, through years before they come and see me, and they are very nervous about starting again. So it's just acknowledging yourself around that, allowing those nerves to be there, but yeah, don't letting them overwhelm you.
So this one is about an ectopic pregnancy. I think it's still very important to acknowledge an ectopic pregnancy as a pregnancy loss. So I'm going to give the question to be answered, having myself personally lost a baby through ectopic and also miscarriages, both equally as horrible. So I've recently had an ectopic pregnancy medically managed with a methotrexate injection. How can I prepare my body to try again? And then they just said, not sure if we can talk about this, but we can talk. So maybe Ali and Tasha.
Yeah, I mean, I would say all the things we were talking about, acknowledge your body for what it's been through and the pregnancy that you have had. So, and really TLC, it's really taking care of yourself, looking at all those nourishing foods, taking the time you need to prepare yourself and allow yourself the healing process. And as Ali said, there's no time frame as such. It's when you are ready and your body is ready, and really check in with your body as much as you can. Listen to your body and what it needs. Get soups and stews and all those rich, nourishing foods to, I guess, heal your way back to a place where you feel confident in moving forward.
Yeah, I would agree with everything Tasha said, and just touching on what we were talking about before, about hope and about positivity. I think really, like, when you feel that you have sort of grieved and that you've healed yourself physically, I think try and visualize yourself having a healthy pregnancy and visualize the baby. I think this is all stuff that really helps, because I mean, if it feels right for you, I think it's important to think positively and, you know, that it is likely to work out next time. Even though that can be scary to think that because you're used to being worried and like, oh, what happens if this happens? But just try and think try and think differently, like that it is going to turn out differently this time, and just focus on that.
I agree with you. I find a lot of patients, they say, I want to protect myself for a negative outcome. I can't, you know, think that's going to happen because what if it doesn't? I'll be really upset. From personal and professional experience, you're going to be really upset anyway. It doesn't help to protect yourself. There is no way to protect yourself from that. That is running at a brick wall. Pink elephants, get the support you need around that, but stay positive, throw everything at it. As Ellie said, look at it, do your affirmations. I've got a list that I send to my patients and get them to choose some affirmations to really feel that, see yourself pregnant, really fall into that space. We'll be there. Get the support around you to, if it doesn't work out, you'll have that support network, but don't try to protect yourself. It doesn't work.
Yeah, I actually, I made a vision board, which I got into crafting, and I did, like, you know, put all these pictures up, and I found that really therapeutic, and it was channeling positivity, and it helped me just look forward. And because we were doing IVF, we had lots of failed transfers, then we fell pregnant, we got a miscarriage. So I was just like, oh, but I was sick of feeling sad and like it's all going to be bad. And then I found that really helpful.
Yeah.
Something that I've been doing the past 4 months is, after I read this amazing book called Spirit Babies. I'm not sure if any of you have read it. It's very beautiful. I've been speaking to my baby every day. I've been visualizing a healthy pregnancy. I was so caught up in this negative, oh, okay, well, if I'm going to fall pregnant, it's going to be a bad result. And I think just noticing myself shift from that negative mindset, which is easier said than done, into this, you know, future positive space, which has really helped me. Okay, we've got one more question. After having recurrent miscarriages, I have had testing done, including blood tests and HSG, which have shown the MTHFR gene. I'm wondering how I would go about having my partner's sperm tested, and is it costly?
I guess the sperm test should be, the fragmentation test is around $100 that Ali mentioned. That is an out-of-pocket test. The MTHFR gene, I'm quite passionate about that one. First, it depends which gene you have and what morphism you have of it. There's 4 different variants. One of them is largely irrelevant. There's probably only one that causes major issues, and really it's a disadvantage. The structure, the MTHFR gene, I guess they call it a mutation, and really I see it more as a spelling mistake. It's a spelling mistake in your code. And as with any spelling mistake, I'm renowned for them. My head goes really too fast when I write. I know what I meant to say, and perhaps when you read the email, you know what I meant to say too. But perhaps, you know, it's Friday afternoon, you haven't really checked your email for a while. I might send that same email with the same spelling mistakes, and you go, hang on, what do you mean there? So really, genes are a predisposition. If we put that gene in the right environment, we can still get a good outcome. And that's why MTHFR affects folate metabolism. That's why I like to check homocysteine as a bit of a marker of how well you're actually metabolizing your folate, because you may have that MTHFR gene, and I get a lot of my patients come to me with that diagnosis. So I'm like, well, this is genetic, it's going to cause miscarriages, it makes it really hard to fall pregnant. Let's just check how well your gene's doing. It might actually be doing okay because you're really healthy and we've got a great environment there. So it just may mean a bit of more work for you and optimizing that, but it's not to say there's something really wrong that can't be fixed. So first, yeah, the DNA, I guess that's one I'm quite passionate about, that MTHFR. But Ellie, you might have something to say on the
no, you've covered it all.
Yeah.
Let me just go and have a quick squiz through all of these questions.
If I could please add something.
Sure can.
Just something I didn't mention about in dealing with your loss along the way. Another suggestion is marking your loss. So it's not for everybody, but a lot of people find a lot of comfort out of it. So by marking a loss, it's creating a space for your lost baby. Now it can be a collection of memorabilia like scans, results, pregnancy tests, a soft toy you plan to give the baby or one to represent the baby. There's those sorts of things. It can be a piece of jewelry, a garden, a tree, that's something that's transportable if you move house, because it can cause distress if you have to move and uproot your garden, obviously. Or a picture, or just something personal to you and your partner, to remember the journey that you're on or you've been through.
Okay. That is it for those questions. Does anyone have anything else that they would like to add? No? All right. Thank you, everyone, so much for giving us this space to chat to you all. That's it for this session. I hope you guys have had some answers to the questions and that you have felt validated and understood and supported while you're going through this really distressing time. It's not pleasant, and we just all want to let you all know just to be kind to yourself and take care of yourself, and we all just want to send you so much love. So thank you all for just coming on and spending your Wednesday night with us.
Thank you.
Thank you.
And thank you to Pink Elephants for hosting and organising.
Yes, thank you.
Everything you do.
Great work, much needed and great work.